Joining us right now to talk more about the country's rollout campaign is Dr. Julie Morita, the Executive Vice President of the Robert Wood Johnson Foundation, also a member of President-elect Biden's COVID Advisory Board. And Dr. Morita, thank you for being with us today. It's great to see you. This is a historic day and one that we've been waiting for a long time. But I guess the question now becomes, what next? Where do we go from here?
Morning, Becky. Nice to see you. So I think a critical thing is that we know that this process has been used by the U.S. to evaluate and to approve the vaccine for emergency use was robust, it was science-based, and it was transparent. And that should be very reassuring to the public because we know that vaccines are safe and effective. But that's just the first step. The next steps are really making sure the vaccines get distributed throughout the nation, and also that people have confidence and faith in the vaccine so they will get vaccinated. Vaccines don't stop pandemics. Making sure that people are vaccinated is what is going to stop this pandemic.
Yeah, there's two parts to that. The first will be the immediate, where no matter how many people are willing to take this, we're not going to have enough vaccines, at least for the foreseeable future. So what concerns you about the logistical headaches and problems that we could run into? What are your biggest issues there?
So when I was a health commissioner in Chicago in 2009 during the H1N1 pandemic, we were able to get vaccine out to healthcare providers. We were able to get it out into the community. The challenge for us was really getting the vaccine into communities of color. There was distrust of the vaccines because of past historical mistreatment. And so as a result of that, we worked with community organizations to really have them help us bring people out to get the vaccines. What I'm concerned about heading into this pandemic is we've seen the disproportionate impact on communities of color. And unless we really work with the communities to understand what their concerns are, get them information that they need, I'm concerned that they won't get the vaccines that they need as well.
Dr. Morita, there's a question about, frankly, whether vaccines should be voluntary or whether they should be mandatory. For example, the New York Bar Association is now pushing on the state of New York to make vaccines mandatory. Obviously, this will be at a certain time when they're available at scale. There's other conversations happening around the country and the world about whether businesses should require their employees to take the vaccine simply as part of their employment. Some believe it could be a competitive advantage to them, while others think that it could create a backlash. Where do you stand?
So I think the first step really in terms of any new vaccine is earning the trust of the public. And how we earn the trust of the public is making sure that they understand that the vaccines are safe, that they're effective, the process was not influenced by politics. We need to ensure that people actually have this information so they are comfortable getting the vaccines. And that's not easy work. Federal, state, local health, public health officials have been working nonstop to make sure that we get the vaccines out into the communities. They are also working with the communities to understand that the safety and the efficacy of the vaccines. But that's hard, it's rigorous, it's challenging work, and more resources really need to flow to the federal, state, and local health agencies so they can do this important work.
But Dr. Morita, again, this is a really important day. I guess the big question is, when do you think it will be before we can actually breathe a little easier? How long do you think it will be before we've really made some inroads against this virus?
Well, again, the vaccine is available in very limited supplies right now, and we're not certain when we'll have enough vaccine for the entire population to have access to the vaccine and to get the vaccine. So in the meantime, it's critical that people continue to do the things that we know will actually work: wearing our masks, remaining distanced socially, not attending family gatherings during the holidays. We need to continue to do those things until we can actually assure that the entire population has access to the vaccine, and that may be weeks, it may be months.
Shepard Smith here. Thanks for watching CNBC on YouTube.